Commonwealth Health Corporation continues to live its mission of caring for people and improving the quality of life for those served throughout South Central Kentucky. 2007 proved to be a year of helping and healing. Perhaps those who know best are the patients whose lives have been changed because of CHC's unyielding commitment and our passion to provide first-rate healthcare services. The Medical Center is committed to providing residents of our region with comprehensive cardiac care close to home. In August, the Medical Center at Bowling Green received full Cycle II accreditation with PCI from the Society of Chest Pain Centers. The Medical Center is the 40th accredited chest pain center in the nation and is the only hospital in South Central Kentucky accredited with PCI.
The use of a PCI, or percutaneous coronary intervention, is used by our cardiologists to gain direct access to an obstruction. This helps reduce mortality and preserve cardiac muscle.
On February 5th, the sound of 3 newborn cries were heard at the Medical Center as Kathy and Brad Harvey welcomed Addie, Braden, and Chloe, the first set of triplets born at the Medical Center since the addition of neonatology services. Because of the Medical Center's expanded and enhanced neonatal intensive care unit, the Harvey triplets were able to remain in Bowling Green, close to Mom and Dad. Today, Addie, Braden, and Chloe are keeping Mom and Dad busy at their home in Glasgow, Kentucky. The Medical Center at Franklin cut the ribbon on its new 25-bed, 11,450 square foot expansion in August. The new patient wing, which is part of an overall $5 million expansion and renovation project, is designed with the patient in mind. Patients enjoy home-like accommodations with private rooms and private baths. Renovation to the previous inpatient wing is also complete and has allowed for creation of 4 observation suites and a new family waiting area.
Commonwealth Health Corporation acquired the Medical Center at Franklin in 2000. At that time, we made a commitment to the community. We wouldn't just survive, we would thrive. The opening of our new patient care wing in August is a testament to that commitment. Now patients are served in one of the most modern facilities in South Central Kentucky.
To better meet the busy lifestyles of the community, CHC introduced the Minute Clinic concept to Bowling Green with the opening of 2 quick care clinics. Staffed by highly skilled advanced registered nurse practitioners, Quick Care Clinic strives to treat minor injury and illness in 30 minutes or less. The war in Iraq has affected many throughout South Central Kentucky. Brooke Talley, a captain with the United States Army, was injured in Iraq and suffered significant damage to his femur and the nerves in his left leg.
Brooke came to us in a wheelchair, unable to walk. As a team, we worked together and initiated a treatment plan, and within 5 months, he was walking without an assistive device.
Brooke's plan of care was so successful that military physical therapists in Texas are now applying this methodology to other patients with similar injuries.
Through research, we developed a very specific plan for Brooke, which included iontophoresis. This treatment helped to break down the bone that was in the muscle from his original injury.
The Medical Center at Scottsville has added Toshiba's Aquilion 16-slice CT scanner. The system includes enhanced features for greater patient comfort and safety, faster exam times, and improved image quality for speedier diagnosis. This is particularly important when determining the extent of injuries in trauma cases, where every second counts. Keeping safety and comfort in mind, the Medical Center added complimentary valet parking service for patients, visitors, and volunteers. The program has been very successful and offers the ultimate in customer convenience. As the recipient of a $16,000 grant from the Kohl's Cares for Kids program, Commonwealth Health Foundation used this gift to build a community walking trail connecting Parker Bennett Curry Elementary School and Girls Inc. The gift also provided 1st through 5th graders at Parker Bennett Curry with free memberships to the Medical Center's Healthy Kids Club. The Foundation's 2007 Charity Ball proved to be the most successful in the event's history. With record-breaking attendance, the Charity Ball raised the most money to date to benefit the Commonwealth Health Free Clinic. CHC not only focuses on caring for those who are ill or injured, but we help those who are living with chronic conditions such as diabetes. Eric Smith was diagnosed with type 2 diabetes in March and visited the Health and Wellness Center to consult with diabetes educator Marissa Vincent.
Since taking advantage of diabetes self-management classes, I have lost 55 pounds. I learned to control my eating habits. I've went down 6 pant sizes, and I'm now taking 1 blood sugar pill a day instead of 3.
In the early morning hours on June 25th, emergency personnel were dispatched to mile marker 42 on I-65 South for a bus crash involving 65 family members, a driver, and co-driver. Over 40 patients were transported to the Medical Center Emergency Department, while remaining patients were sent to other hospitals throughout the area.
As social workers, during the aftermath of the bus accident, we were assisting family members in locating each other since they were at various facilities in our area. We were also assisting our patients with their multiple needs during this very difficult time.
It was very intense. There were patients in every room and in the hallways. We had called in additional physicians and extra staff. We had helicopters on standby. Everyone was working so hard and so fast, and we successfully treated over 40 patients from the bus crash that day.
Although the event seemed to be in jeopardy earlier this year, the Medical Center took the 10K Classic under its wing to ensure that the event remained a tradition in Bowling Green. This year's race was especially important for one local resident, David Crawford. In 2006, David suffered a heart attack as he ran down the Avenue of Champions toward the finish line during the Medical Center 10K Classic. Medical Center EMS paramedic Megan Jennings was the first to David's side.
As soon as I got to David's side, I realized something was very wrong with him. He had no pulse and his breathing was ineffective. We hooked him up to our monitor and made the decision to shock him. After about 20 seconds of CPR, he had a strong heart rate back.
David underwent open heart surgery at the Medical Center, and this year he was back for the 28th running of the Medical Center 10K Classic. In 2007, Commonwealth Health Corporation celebrated new life, enhanced the quality of life for those in our community, and saved the lives of others. Our dedication to helping and healing is what drives CHC's mission to provide exceptional healthcare services in South Central Kentucky.